Another topic we want to talk about is the general public, I think, is familiar with the overall profession of nursing, but they don't realize how many varied areas that it makes up nursing. So I don't know if each of you could take a minute, talk about an area that maybe you specialized in and what your experience has been, or some of the varieties of fields that make up the nursing profession as a whole. Jim, if you want to start for this question.
Absolutely. So, as I said earlier before, when I was, in my associate degree program, I was working hematology oncology. So when I earned my associate degree, I worked in that unit and then transferred over to the bone marrow transplant unit at Hahnemann. Worked there for several years, and then when I was in grad school, I worked in the psychiatric medical care unit as well. And
bone marrow, then psychiatry, those are pretty diverse fields. Was it tough to switch between those?
No, because actually, even before I worked at Hahnemann, I was working at a psychiatric hospital in Fort Washington, PA, and that was only from a course that I took after high school. It was a certificate program as a psychiatric assistant with a school program that offered medical and dental assistant as well. So, that wasn't too difficult for me at all, and having the medical background as well. So, that was not too difficult.
Okay.
Yeah, and then after that, I started working with the fast track emergency room at Hahnemann. Learned a lot there, and pre-admission testing. And from there, I came over to Jefferson Hospital in Washington Township, which was Kennedy at the time. And I was working with the hospitalist team there.
Right. Now, can you talk a little bit about, what were the reasons why you made these changes? Was it these because of areas that interested you, or was it something else that your employer required?
Well, no, it was just areas that interested me, and I just wanted to get, a little bit of depth and mostly breadth of, different opportunities.
Great. So I think it really illustrates, what the opportunities are to pursue, individual career path in nursing.
Exactly right.
Yeah. Okay, Chuck, what can you add to that?
So myself, I chose nursing for multiple reasons. One of the reasons is that there's so many vast things you can do in nursing, including, like Jim said, you go from the clinical practice, then you have the leadership practice. I had the honor and privilege to be working academia here at Sam Community College, which I never thought initially in foresight. I just thought I'd be like a clinical instructor for some students. I also had done administrative in the acute care setting, in the hospital setting. It's one of those jobs where the more experience you have and exposure you have to different specialties in the realm of nursing, it makes you more marketable. And for myself, I knew I didn't want to do something for 40 years, do the same job where, traditionally my father, grandfather would go out to work. And so that was one of the reasons why I chose nursing.
Now, did you ever find some resistance or roadblocks in getting the variety of experience that you needed to move forward?
I've been very fortunate in my profession. I went right out of school into critical care, which is, back then, was unheard of. This is the late 90s. So I was very, very fortunate there. Traditionally back then, you had to do 2 years med-surg. And on top of that, I was able to get a $3,000 sign-on bonus and day shift. So I said, sign me up. But I did relocate. I did come down from Philadelphia, where not everyone wants to do that. So I did relocate from the city market, and which I don't regret at all, and I've been here ever since. But I also, same way as going into urgent care, I did my experience, and as I always tell the nursing students, you're in the longest job interview while you're there as a student. And my employer picked me up right after I graduated.
Okay. Guys, you guys are painting a pretty rosy picture of the nursing profession. Sign-on bonuses, career flexibility. You're making me.
Yes, that's right. Yeah.
I think I'm going to look for a nursing school application after this today.
It has multiple opportunities. Really, sky's the limit. It's what you put into it is what you get out of it.
Okay. Yeah. All right, you want to go ahead?
Sure, that's absolutely true. There's just so many ways to go about it. I came from a background as a pharmacy technician, so I already knew, medication, and I decided that I needed to get more, clinical hands-on. Would be much more exciting. I always wanted to do critical care. That was my goal, and I did not do that. As soon as I graduated, I took a job, at the hospital I was working at in med-surg, and, basic nursing, and I actually, fell in love with that position. that's what I like to do, providing patient care. So, there's just so many other ways you can go from there. That is, the general reason why I took nursing on.
Okay.
But then, working in med-surg, I think I kind of like mastered it, I would say. And that's why I chose to go into leadership. So I've been, nurse manager for over a year now. And I love that. I think it's great.
Okay.
Yeah.
Chris, you talk about your experiences?
Honestly, I could talk for about 2 hours and I'd be done.
You go everywhere.
Dude, I go everywhere. So like I said earlier, I've been in the ER, I've done oncology, med tele, ICU. The highlight of my career so far, though, has been travel nursing for sure. We started in 2020 when COVID hit. Went to New York City right at the beginning because we had a daughter who was born March 28th. So it was kind of like, how do I navigate this? How do I go to work, not bring something home? That kind of deal.
Right.
So I went to go help out. Long story short, I've been all over the country. Found my way back to New Jersey. As far as the diversity in this job, as far as the branches, it's endless. I mean, I have talked to people who have, similar to Zach here, did their med tele, then go to leadership, et cetera. Got the nurse practitioner, work at urgent care, who work for pharmaceutical companies, who work as nurse lawyers. There's so many different branches to the one tree, and you don't always think about it that way. So I tell people all the time, like, nursing is kind of just your base. Think about what you want to do, and if you don't like it, try something else.
All right, great.
You know what I mean? So there's so many different routes to go.
Yeah, we don't want to paint too bright a picture because, of course, nursing is a very demanding profession, but it's great to hear that, gosh, you have the opportunities to find the branch of it that you want to work in that suits, whether your personal situation or your interests. Any one of those can help guide you on the right path. Okay, I definitely want to hear, what your input is on this too.
When I graduated nursing school, so I had a choice. I got offered 2 jobs. One was to be a psychiatric nurse, and the other was to work like in a long-term care, kind of like a subacute care nursing facility. So I actually decided to do that one, the subacute care / like nursing home facility, because I still wanted to, at the time, have general skills, I guess, for in case wherever I wanted to go from there with my career, because we had a lot of PEG tubes, there were trachs there, IVs, TPNs. But after being there for years, I was like a supervisor there. I really just realized I wanted to be like a psychiatric nurse, more for just where I come from and my background. I've had a lot of issues when I was younger growing up, got myself out of a tumultuous situation, I guess you could say, to get into nursing. So I can resonate more with the people that I work with now, the patients in the psychiatric nursing field. But there's so many opportunities to advance and just go wherever you feel comfortable. Like, I know a nurse that does Botox injections. That's just what he wants to do. You can go work at like a Rite Aid and giving vaccines, flu shots, any kind of clinics, working at the CSL plasmas. It's just wherever you feel comfortable and whatever suits your interest and even your schedule. Because to me, I don't like working Monday through Friday, 5 days a week. I would never really feel okay doing a doctor's office nursing job. I like doing the 12-hour shifts, having more time off to pursue other things, because I'm actually in the process now of trying to get my advanced practitioner license, which I always thought I would never do more school. I was like, once I get this, once I reach this point,
What's next?
I was like, I'm so tired of being in school. I'm done with school.
Yep.
But now that I'm in, I'm like, man, let's just go one more step. And who knows? Maybe from there I'll have to go up again. But for now, hopefully in the fall of this year, I'll be able to start that program.
Okay.